And there was one more thing that you spoke when we started with a conversation, BMB. Let's talk about BMB, the dreaded swear word.
It is next to Dex. I think it's the second, maybe it's equal with dexamethasone. People talk about Dex being the worst thing about myeloma. The BMB, the bone marrow biopsy. Yeah, did you have one right when you were diagnosed?
Yes, and it wasn't a pleasant experience. I was obviously, as I mentioned, like I had a surgery, an emergency surgery. It was pretty, it lasted for 6 hours, and I was wrapped up in all sorts of things. And then I had to have the BMB whilst I was on an ICU bed. So totally not the best place to start. And it was the first time I was going to have it. So it wasn't a pleasant experience. It was super painful. They could not sedate me, for obvious reasons, because of whatever was going on. But post that, I had the next BMB. I've had a couple. I'm not sure if that's a good thing or a bad thing. But the next one, I had it in Mayo, and I learned that I could actually be partially sedated. And so I wouldn't feel anything, which was like, oh my gosh, like I thought that was the best discovery mankind had ever made, and ever since then, I've always requested for, being sedated through that process, because otherwise it can be really, really painful. So I don't know if you want to talk about what the procedure is. I'm going to assume some of the folks here have been through this, unfortunately.
Yeah, well, because the bone marrow biopsy is the only way to actually see the myeloma cells, the cancerous plasma cells, it is necessary. It's also necessary to get it done so they can diagnose the genetic abnormalities, the cytogenetics. But yes, I actually had a little bit different experiences. So again, every patient is so different. I prefer not to be sedated because I don't like sedation. I don't like the way I feel. I don't feel good when I have it. So I did have it done. And when I was where I went the first time, they didn't offer sedation. This is 20 minutes and wasn't comfortable. I will admit that. I didn't like, the worst part for me was when they numb the area with lidocaine, they give you the little shots before they do that. So I've had 6 of them total now. But I've had the most recent one, the 6th one I had, they did sedate me, and I think it's conscious sedation. So it's like you said, light sedation. I don't remember any of it, but I didn't like it because I had 2 days of recovery from the anesthesia. So yeah, so I think the going back to somebody who's maybe anticipating that, for 2 nights straight, I couldn't sleep. I was so nervous about the bone marrow biopsy. I just thought this is going to be so painful. I had excruciating pain in my spine anyway, because it was collapsing as I was going through. I had radiation first. So the bone marrow biopsy didn't seem to affect me quite as much the first time, but this last time, it seemed to be a little more uncomfortable, especially afterwards. But from my understanding from the bone marrow biopsy, they go in either with the needle, basically the thick needle, or Mayo, I don't know where you go, the Mayo Clinic in Scottsdale uses a drill. And I guess that's supposed to be faster. And a lot of people think it's more comfortable. Go into the bone marrow and try to take some of that bone marrow out, the soft part of the bone out. They actually take 2 different samples. But I think the most uncomfortable part of you're not sedated, I think, is that vacuum type feeling. And then there's like a pop. And that was super uncomfortable. I thought that was probably the worst part. I'm not sure if it's pain or discomfort or what, but I do remember that. Looking back though now, every time I've had one, I always say that wasn't so bad. I remember it, but it wasn't, I don't remember it being too bad. So what they do is they will collect, and they usually have a lab person available as they're collecting to make sure that they have enough of a sample and the right cells and enough of it. So they usually will only go in once. I had once where they had to go back in a second time to try to aspirate some more of the bone marrow. They'll look at that. It takes a few days to go through the lab and look at that and see what your genetic abnormalities are with the myeloma cells themselves, and what the volume of cancer cells is in your bone marrow. But yeah, I just remember that either way, if you're sedated, you don't feel it at all while it's happening. If you're not sedated, you can feel, especially when they're numbing it up, the lidocaine shots, and that stings. It's a sting, 3 or 4 times, and takes a little time for it to set in. And then that suction, that pop, that's what was the most uncomfortable. And I think that really the the most pain that I felt was the bruise-like pain the couple days afterwards, and not walking, but just sitting on it. It's bandaged up really well. You can't take a shower for a day. But when I would go to sit on it, it just felt bruised. But yeah, the bone marrow biopsy, nobody looks forward to those. It's nice to know that there is something in the works, even mass spec testing, which isn't quite as sensitive. It's nice to know that there's something in the works to maybe look at other ways to test for the myeloma. Yeah, not fun. It's a necessary thing though when people are diagnosed with multiple myeloma.
Yeah, that's absolutely the true statement. Like, I don't like it at all. I am also anxious before I have the, like I've had 4 now. So, and every year I'll have to have 1. So I know that that's, that's a necessity, as you said. I do feel anxious, but I keep telling myself like this is needed to assess the overall disease involvement. And, hopefully the results are better than last year. So, that that's how I sort of, create some positive energy around that experience, because it's not a pleasant experience. And as you said, like, it does hurt for a couple of days after. I actually have, sometimes it goes on for a week that I have that discomfort. But again, each to his own, like, people might have different experiences. But, I think the more we talk about it, the more we hear other people's experiences, we might just feel like, hey, mine was not all that bad. Like, look at her, him, whatever, like what they've gone through and things like that. Or even just thinking like, it's different, it's nuanced. Everybody goes through different experiences. Like, you prefer not being sedated, I prefer being sedated. So it depends on each one's experiences. But what the bottom line is, there are options available. Everybody understands it's a difficult procedure. Everybody understands it's not pleasant. Nobody wants to put the patient through that if they had a choice. Right now, we don't have one. So, I think just thinking about it in a positive vein and embracing it, I guess, might just help. It helps me. So I'm hoping that it helps others as well, just changing the perspective a little bit.
Yes. So who does your bone marrow biopsies? I've been to, sometimes a nurse practitioner does them and sometimes an RN does mine. And I know some of our local doctors do them, oncologists do. What type of professional does your bone marrow biopsies?
So with Mayo, I've had it twice there. They have specialists. They have a whole team that does. Obviously, Mayo, they do like, treatments. Like, they have 500 patients doing like SCTs every year. That's what I heard. I had mine there too. So, it's a well-oiled machine. They just have departments for every little thing. So that's different. But even when I do it at my local cancer center, they have a specialized team. So it's not the nurses. There's a specialized team. There's a different procedure. Again, like, it's different to how Mayo does it. When I do it at my cancer center, they actually do a scan before I have the BMB, and to make sure that they're going in the right place, which I thought was like, wow, that's great, just as a second level of precision. But yes, that's different to Mayo, but it's always like a specialist doing it for me.
Yeah. And then how often do you have to have those on a regular basis, like annually, or just as things change with treatment?
Annually. So only just
Okay.
for my, obviously, diagnosis, I had that. And then 6 months later, I had a stem cell transplant, and I did a BMB prior as well. And then a couple of months after, I did that again. So that was the only time when it happened more regularly. But since then, it's been like yearly.
Yeah. Okay. Yeah, the bone marrow biopsy is interesting because I know there's different ways that they test that, and now they have a more sensitive test. So everybody has different, that's the other part of the alphabet soup. Some people have something called flow cytometry or NGF or NGS. So anyway, yeah, it's kind of interesting that everybody will have different ways of going through that or different experiences. So anybody who has questions, welcome to reach out to me at Penn or any of the other resources that are out there.